Hi, everyone. I'm Reza Jarhi, and this is continuing part of the founder series for the International Society of Craniofacial Surgery. I have the privilege and honor of chatting with my mentor, Henry Kawamoto, who needs no introduction, but I'm going to ask him to do a little introduction anyway. How are you, Dr. Kawamoto?
I'm fine. Great.
Great. Yeah, between the two of us, it took some effort to get this set up, but looks like everything's all systems go. Um, I want to talk to you about, the foundation of the International Society and, craniofacial surgery in general. And I don't have any structured program. I don't have notes. I just have, millions of mental notes from knowing you for the past, I don't know, 20 plus years. But I thought we might organize a discussion in terms of, you know, the past, present, and future, if you will. So maybe we can start with the past. And, I said there's no introduction necessary, but I've found in training residents and fellows, a lot of them have lost an appreciation for the history of craniofacial surgery and the personalities who created that history, such as yourself. So, can you tell us a little bit about your training background, even going back to your early education, high school and college, and what drew you to plastic surgery and craniofacial surgery?
Well, actually, I went right from high school to a community college for 2 years and then got accepted into dental school. And in my second year of dental school, I saw an operation by an oral surgeon, Marsh Robinson, on my classmate to treat progressivism. And I said, God, that sounds interesting. So I thought I would do that. And Marsh Robinson was also double degree at that time. So at night, I took some pre-med courses since I was short on courses and got my requirements out of the way. Very, very interesting. I interviewed at UCLA for medical school, and Wiley Barker at that time told me, you should spend another year out.
Hmm.
And I said, no way. I was a young man in a hurry. I had also applied to USC and got in over there. I had a great time in medical school, actually. The first couple of years were same as in dental school. So I was able to practice at night, a couple nights a week, and on Saturdays, the first 2 years. And the guy sitting next to me was Hamilton Kelly, Kawamoto Kelly, and he was big into cars and got me interested in cars. And that's how I started racing with him. And the first 2 years, I was able to work 2 nights a week and on Saturdays to earn the money to pay for the damn car. Then after that, for some reason, I decided to go to the East Coast for continuing my training. I went to Columbia for the first time, as well as Hopkins and Penn and whatnot. And I had the worst interview of my life at Columbia. I got toasted by Alfred Markowitz. And I had a classmate who was a medical intern there, and I called him on the way to Philadelphia for another interview. And I told him what a bad interview it was and whatnot. But lo and behold, I get accepted, and I go to Columbia, do my general surgery there, get drafted, and was very lucky actually because I went down to Washington to tell them that I would go anywhere, but I wanted to do surgery. Since I would only have 2 years, I knew I was going to be what they call a GMO, a general medical officer. And I told them I didn't want to do that. And lo and behold, they sent me to Japan. I got married right before we left. And in Japan, there were 5 fully trained general surgeons. I had my own ward of 57 patients. And I was able to handle most of the stuff. But when I got in trouble or had questions, I would lean on one of the 5 general surgeons and they would coach me through whatever I had to do. I really learned how to operate quickly and efficiently during that time since the patient numbers were, always rolling in and out. And then for some reason, the guy that was running the ENT service was leaving. So the commanding officer asked me if I would just, take over in that role for a while until a replacement came. And what happened was I said, fine. And I went over there and the guy taught me, he said, well, the only thing you really have to know is read audiograms. After you read the audiograms, if the red line is above the blue line, then it's a conductive hearing loss. You keep him here for a while and then you send him back to Vietnam. And then if it's the other way around, it's neurosensory. They won't get it back. You send them to continental United States, CONUS. I said, okay, got it. So I'm doing that and working with the oral surgeons, handling the maxillofacial injuries, you know. It was good training, actually, for a guy that didn't have any training in facial reconstruction. The new ENT guy came about 3 months later after I was reading the audiograms and all that. And he was looking over my shoulder one time and he said, what are you doing? I said, well, this guy goes to continental United States, CONUS, because of the neurosensory loss, and the other one going back to Vietnam, it's conductive. We'll keep him here until he gets it back. And the guy said, Kawamoto, you got it backwards. So I was sending the stone deaf guys back into Vietnam. And the guy said, but it's on the job training, it's army training. And after that, I had a lot of exposure to maxillofacial trauma because I was working with the oral surgeon there. And it was right up my line. And then I went back to Columbia and finished my general surgery residency. And actually, my co-resident, he came back from the Coast Guard, and that was Joe McCarthy. And so Joe and I were fellow residents together, and we got along great. Joe's a great guy, and we had good fun together. And he got accepted to Converse's program. And at that time, Converse's program was just sort of getting off the ground. And when you're at Columbia and Joe was going to NYU, that was sort of scandalous. I get a call from Joe, or Joe says, hey, there's one spot open there. Why don't you go down and interview? I said, my wife and I, we want to get out of New York. We've been here 4 years.
This is now like late 60s, 69, 70?
Early 70s, actually. And so I went down there for the interview anyway. And then next morning, I get a call that I'm accepted. My wife and I really talked it over at that time because, Converse's program was just coming on up. And we thought 4 years in New York was enough. But then Converse called. I talked it over with my wife, and we just said, okay, we'll stay another 2 years. It's kind of interesting because at that time, the Converse program was just sort of getting off the ground. But when I started, it was Joe McCarthy, myself, Sam Hamra, and a person by the name of David Nyes. And so, we had a pretty good team working together. It was great fun with those residents.
And Sam Hamra went on to become internationally renowned facelift surgeon.
Yes. And the foreign fellow at that time, interesting enough, was Francois Firmin, who got a great reputation in ear reconstruction and breast surgery when she went back to Paris. And actually, during the senior, I can't remember exactly, Tessier was a visiting professor. He had just come down from the international meeting in Montreal and spent the week at NYU. And I missed the whole week because my family, we were vacationing at Bermuda for a week. I missed the whole time that he was there.
That's interesting because when I was your fellow, I was told we could take no vacation, but I'm just saying. Anyway, please continue.
As I was finishing my residency at NYU, I decided I'll try to go to Paris. Through correspondence and help from Converse, I got a chance to go with Tessier and study. It was kind of interesting because when you're first there, you just sort of sit on the side and watch what things are going on and whatnot. He already had two fellows or associates. One was associate, Yvon Rollo, who eventually became his partner and then left to become a full-time academic surgeon in Paris. And Walter Peppersack, who was double degree from Zurich from Obergese's program. And so when I went there, he had lots of help there. And lo and behold, what happened was there was a transfusion reaction. And the nurse anesthetist and nobody in the room really knew how to handle it. And of course, in my general surgery training, I knew how to handle or take the first step, give mannitol and whatnot, and flushing out the system. And that worked. The patient did all right. And after that, I was sort of welcome as a member of the operating team and was able to operate with Tessier.
A nice way to impress Monsieur, right? Right off the bat, save a patient, but no one else knew what to do.
It was quite an interesting year,
I want to get deeper into that year in a minute. I just want to go back and just clarify. So, people find their ultimate calling, if you will, in medicine via different ways. The thing that first piqued your interest was seeing a jaw surgery case by a dentist, or was he an oral surgeon?
Oral surgeon. He was an oral surgeon, double degree oral surgeon. Yeah, Marsh Robinson.
Yeah, so in the back of your mind, you thought, hey, I sort of like that. Maybe I'll do it. But then at that point, the route was either oral surgery, as this mentor had demonstrated to you, or to go to medical school and become a doctor. In other words, why did you choose to go the MD plastic surgery route instead of just going through oral surgery training only?
I don't know how that happened. I just don't remember where the decision was made to go and study to become a plastic surgeon rather than going through the oral surgery route.
And it seems sort of fortuitous that there you are overseas taking care of these wounded warriors, and there happened to be a bunch of facial trauma injuries that come through, and you had finished dental school at that point, correct?
Yes.
Yeah, so because of that training, you were the guy to go to. It reminds me of learning about how Gillies essentially learned his mastery of craniofacial techniques in World War I and World War II by treating facial trauma patients. So you seem to have had a similar exposure in that regard.
Yeah, but that exposure was too early. It would have been better after I was trained. But I learned a lot from the oral surgeon. It was just a fortuitous.
And then, speaking of fortune, you end up at NYU with Joe McCarthy, Francois Fumin, and Sam Hamra and Dave Nyes. And that's a pretty incredible cadre of individuals in one training institution at the same time.
It was more interesting because at that time was Kim Won Kim from Korea, who really became sort of the father of plastic surgery in Korea. He went on back. And Cassil Raposo, the armorer from Brazil, who built his own hospital, 26 or 7-bed hospital just for craniofacial surgery. There was a lot of, really good people there at that time, and things just moved at a lightning pace.
So let's get to Paris now. You already have brought us into the operating room, and here's a patient who's going south because of a transfusion reaction. You save their life, and Tessier takes notice of you. Hey, this guy knows what he's doing, and doesn't sort of hurt in that environment where I imagine it's sort of a competitive environment with all the visitors wanting to distinguish themselves to the master, or was it very collegial in that regard?
Tessier really didn't mind the visitors. There were a whole bunch of them, as you know. He had them classified. If you were there for 6 months, you could be a fellow. And if you were there for 3 months, you were a visitor. And anything below that, you were a tourist. It was just an interesting time. It was really an interesting time to be in Paris. My wife, bless her soul, she went through all this crap. I met her actually at Harvard General Hospital. And then when I went to New York, she also went to New York. And when I got drafted between my training in the Army and actually in Austin, Texas, Fort Sam Houston, there was a week break there before I got sent to Japan. And that's when we got married. And we went to Japan. And that was quite a interesting time, actually, just socially and getting used to the different culture and whatnot. And my wife, who was Caucasian, worked actually on the economy as a occupational therapist. And she would get on a bus and travel across Tokyo to her place. She would say every time she got on a bus, the bus driver would be looking at her and wondering, does she know where she's going? Because she was going off not in a tourist area. It was quite good, actually.
I didn't know that about Kathy. What I do know, and I've always adored her, and I'm sorry that she's gone, but what I do remember quite distinctly is that every meeting I was at, no matter where on the planet, if you were there, she was right there by your side. And that was lovely. Well, take us back to that operating room in the early to mid 70s after he sort of came on the scene in the mid to late 60s. Some people are calling him crazy because of things he's doing. and yet he presented his first, was it Lefort 3 or Monobloc? I can't remember. And he's starting to get some credibility as a true pioneer. And then all of a sudden, there you are, along with a German and a Brazilian and other Americans and so on. But what was it like? What was, how did he prepare for the OR? How did you, as his fellows, prepare for the OR? Was there a sense of a need to prove himself to the community of naysayers out there, or did he know that his vision was spot on, and the more work he churned out, the more people would see and so on?
Actually, being in the OR with him was an experience. Nobody said anything. He had a great scrub nurse, Elizabeth Heck. I remember very clearly one time we were doing an operation and he stuck out his hand to get an instrument, and she slapped it into his hand, and he looked at it, no, and then he thought, oh yeah, that's the instrument. I mean, she knew the operation better than
Give me what I need, not what I want.
as well. And it was a marvelous thing to watch, that symphony going on between the two. Tessier didn't say much in the operating room. He didn't talk. He didn't say or explain what he was doing. He just went ahead and did it, and you just had to watch. An interesting story about Tessier that's never been written was he was preparing to do either facial bipartition or Lefort 3 for the International Congress that was being held in Paris. I think it was 76 or so. He had done this operation many times, and also in preparation for the meeting. It was going to be live televised, and he had every step of the operation written and posted in the operating room so the whole team would know. It was something like 270 steps or something like that. And each one of them was timed so that he could finish this operation in the allotted time.
Was he right on time? I would assume.
He was right on time.
So it sounds like it was long days. I think Dr. Wolf also had spoken about this in his series, just incredibly long days and nights. And at that point, he was not going down to Nantes for his cadaver studies or his skull studies.
That was before. That was way before he did his first operation. No, he was not going to Nantes at that time. He was mainly focused in Paris. And the last time he went to Nantes was for his funeral. The funeral proceedings were in Val de Grace, which was a military type of hospital. His funeral services were held there. And the next day, a train was taken from Paris to Nantes for his burial. And interesting enough, knowing how precise Tessier was, I think he was trying to tell us that it was not time to go. We were all at the gravesite. And the damn coffin was about 5 millimeters too long and wouldn't fit. Can you imagine? It wouldn't fit. So they had to take him away and store him someplace for the night and chip out the graveside. It was a family one. So either that, or I think they may have shaved on the coffin so that it would fit the next morning.
Would have thought that you and Tony and Dave Matthews, Cassio would have just gotten the shovels and said, hey, we're going to Tessier this problem. We're going to start digging. I asked you about your training history, and just naturally you referred to all of your mentors and all these figures that I know most of, but not all of. I think that it's something that's been lost on the current generation of surgeons who maybe don't have an appreciation for their history. And, it was certainly trained into me by you and Jim Bradley that the true meaning of we stand on the shoulders of giants means that we have to know who those giants were and what they contribute, if not specifically, then at least sort of spiritually to the field. So let me ask you, I guess, a broad question that brings us from those days in Paris through the present and future, and say, first of all, this is a recording for the International Society of Craniofacial Surgery. So how do you think the society has fostered education in craniofacial surgery? And if this, to some degree, is Tessier's living legacy, this society, what would you see the society do moving forward? And then sort of couched in there is the very early days of craniofacial surgery with Tessier's drawings and anatomical studies, now to virtual surgical planning for almost everything we do. do you think the most valuable contributions have been by your generation as sort of the first generation, Tessier disciples? And what do you think we should focus on in the coming years to continue to advance the field?
Well, I thought about that, and I had to give the president's speech one time for the American Cleft Lip and Palate meeting in Colorado. And I was a little bit pessimistic at that time about craniofacial surgery because we just trained too many people and there aren't that many patients anymore, and as time goes on with prenatal screening and whatnot, we may see a lot less patients. It is my understanding that in Taipei, there was a drop in cleft lip and palate, like something like 40-something% in 1 year. And you say, wow, why? Mandatory ultrasound. As time goes on, we're going to have, I think, probably less teratogens causing some of the birth defects. Yes, we're able to build the lives and faces of patients, let's say like a Crouzon's patient, that will go on and have a higher probability of having a child with Crouzon's. But I'm a little bit worried about that. We may be running out of congenital deformities, coupled by the fact that we have too many training centers. Yes, we'll still have fist fights, smashing faces, and auto accidents, but I'm worried a little bit about the congenital stuff.
Yeah. Richard Hopper is the president of the International Society this year. And, for my money, he's the best craniofacial surgeon in the world. That's just my opinion for so many reasons, not only his technical skill and his command of, mid-face and Le to distraction, etc., but also just his perspective and his outlook. And the pre-conference symposium for the meeting this year is focused on artificial intelligence and sort of the new waves of technology that are coming to impact how we perform surgery. The way I see the ISCFS is to, on a global scale, take into account some of the things that you just mentioned, dropping rates of congenital disease and so on, and also keeping us up to date with the most modern and advanced techniques for diagnosis, treatment planning, and intraoperative care and postoperative care, and to drive the bus forward, so to speak. But that's a very interesting perspective. Fewer cases, too many trainees doesn't make for a good culture. So it's an interesting message for all of us. Any other message for this audience of international craniofacial surgeons who are looking at this?
No, but it's really a great field to be in. It's a lot of fun and highly educational.
Well, I speak on behalf clearly of me, everyone who's ever passed through the doors at UCLA, and I think every member of the society who's looking at this. It's really a great honor that we're all able to stand on your shoulders. And we're incredibly grateful for what you've done for the field in general, for the society, and personally for me, for being the most important mentor I will ever have in my life. So I want to thank you for that publicly in this forum. And now I'm going to come around the corner and shake your hand.
Well, thank you very much for those kind words.
Thanks, Dr. Kawamoto.